Thank you. Thank you. Okay, page 116. I'm sorry. Open the book, your books, page 116. And please, you can, okay, you don't need this. Just take a look at this table, yes? At this table.
Okay.
Let me read for you. Guidelines for people infected with conjunctivitis. Infected with conjunctivitis. So, okay, like this. Number 1. Yes. Page 116. 116. Take a look at this table. Take a look at this table. This table.
Teacher, right.
No, just listen to me, okay? You can take a look here.
Okay.
Not necessary to write, only listen to the teacher. Okay, number 1. Have parents or guardians bring you to visit a doctor to care it properly. Not cure. To care it properly. Have parents or guardians bring you to visit a doctor to care it properly. Number 2. Always wash your hands. Do not rub or scratch your eyes because it could make it worse. Always wash your hands. Do not rub or scratch your eyes because it could make it worse. Number 3. Do not share personal belongings with others, such as towels or handkerchiefs. Do not share personal belongings with others, such as towels or handkerchiefs. Number 4. Avoid sunlight and dust by covering the infected eye with gauze. With gauze. Gauze. Okay? Let me read once again. Guidelines for people infected with conjunctivitis. Number 1. Have parents or guardians bring you to visit a doctor to care it properly. Number 2. Always wash your hands. Do not rub or scratch your eyes because it could make it worse. Number 3. Do not share personal belongings with others, such as towels or handkerchiefs. Number 4. Avoid sunlight and dust by covering the infected eye with gauze. Yes? Next one. Prevention of transmission and spread of conjunctivitis. You can write down prevention of transmission and spread of conjunctivitis. Next one. Of transmission and spread of conjunctivitis. Yeah, write down in your notebooks, please. Prevention. Do you know what is it, prevention? Yes? Prevention of transmission, yes, transmission to other people, and spread, yes, spread of conjunctivitis. Okay, prevention of transmission and spread of conjunctivitis. Conjunctivitis, yes. Guidelines for people infected with conjunctivitis. And number 2, prevention of transmission and spread of conjunctivitis. Prevention of transmission from one person to other, transmission, or spread, yes? Spread of conjunctivitis. Spread some disease. Spread of COVID-19. Yeah? finish?
Teacher, one line.
Just listen and take a look at the book. In the book. Okay. Let me read about prevention of transmission and spread of conjunctivitis. Number 1, always wash your hands. Do not use your hands of dirty cloth to wipe or rub your eyes. Once again, number 1, always wash your hands. Do not use your hands or dirty cloth to wipe and rub your eyes. Number 2, do not share personal belongings with others, and always clean your personal items such as clothes, towels, and handkerchiefs. Do not share personal belongings with others, and always clean your personal items such as clothes, towels, and handkerchiefs. Number 3, avoid close contact with people who have conjunctivitis. Avoid close contact with people who have conjunctivitis. Number 4, do not play in a dirty river or canal. Okay, do not play in a dirty river or canal. Number 5, conjunctivitis infected people should stay home. Do not get clothes with or share items with others to prevent friends and other people from catching conjunctivitis. Do not play. Conjunctivitis infected people should stay home. Do not get clothes with. Do not get clothes with or share items with others to prevent friends or other people from catching conjunctivitis. Okay, and write down number 3. Dengue fever. Dengue fever. Yes. Dengue fever. Okay, let's read about dengue fever. It's another disease. Dengue fever is caused by a virus and transmitted by mosquitoes. It can be transmitted by mosquitoes. Yes? Dengue fever is caused by a virus and transmitted by mosquitoes. The mosquitoes that transmit it are usually active during the daytime. They bite dengue-infected patients and then spread dengue fever to other people when they bite people. Okay? They bite dengue-infected patients and then spread dengue fever to other people when they bite people. Yes? Once again, dengue fever. Dengue fever is caused by a virus and transmitted by mosquitoes. The mosquitoes that transmit it are usually active during the daytime. They bite dengue-infected patients and then spread dengue fever to other people when they bite people. Yes? Okay, take a look at the next page, 117. Symptoms of dengue fever. Patients have a sudden high fever for a long time. Sudden high fever, yes? Loss of appetite. Headache, nausea, vomiting, abdominal pain, and widespread skin rash. Widespread skin rash. Yes? They may have black colored or bloody stools as the fever decreases. Patient might have restlessness, cold hands and feet, mouth brushing, severe abdominal pain, a sudden slow heart rate, and low blood pressure, which can lead to shock. It can lead to heart shock. Yes? Once again, symptoms. Patients have a sudden high fever for a long time, lost appetite, headache, nausea, vomiting, abdominal pain, and a widespread skin rash. They may have black colored or bloody stools as a fever decreases. Patient might have restlessness, cold hands and feet, mouth brushing, mouth bruising, severe abdominal pain, and sudden slow heart rate, and low blood pressure, which can lead to shock. Guidelines for people infected dengue fever. Okay, write down in your notebooks. Guidelines for people infected dengue fever.
Oh my
Once
god.
again.
Okay, đi sao bạn?
Okay, guidelines for people infected dengue fever. Guidelines for people infected dengue fever. Ready?
Teacher.
Yes? E, like this. This is the same word. Guidelines. Guidelines. E. Letter E. Okay, let's read. Guidelines for people infected dengue fever. Number 1. Do not take medication to reduce the fever by yourself. Do not take medication to reduce the fever by yourself. If you have a high fever over 2-3 days and symptom similar to dengue fever, you must see a doctor immediately. Do not take medication to reduce the fever by yourself. If you have a high fever over 2-3 days and symptoms similar to dengue fever, you must see a doctor immediately. Number 2, eat healthy food and have enough rest. Eat healthy food and have enough rest. Number 3, follow your doctor's instructions strictly. Follow your doctor's instructions strictly. Okay, the next one, prevention of transmission and spread of dengue fever. Prevention of transmission and spread of dengue fever. The same, like this. Prevention of transmission and spread. Prevention of transmission and spread of dengue fever. Yes? R, like this. The same sentence. prevention of transmission and spread of conjunctivitis, and prevention of transmission and spread of dengue fever. Finished? Very good, very good. Okay. Prevention of transmission and spread of dengue fever. Number 1, avoid being bitten by mosquitoes. Do not go and play in a dark and stuffy place or room without mosquito wire screens. Always sleep with a mosquito net. Avoid being bitten by mosquitoes. Do not go and play in a dark and stuffy place or room without mosquito wire screens. Always sleep with a mosquito net. Number 2. Boys and girls, listen please. Okay, number 2. Shh. Number 2. Get rid of any standing water areas around your house. Get rid of any standing water areas around your house. School and community where mosquitoes breed. Put salt or abate in containers with standing water in the house, such as a vase and saucers in the pantry, to prevent mosquitoes from breeding. Number 2, get rid of any standing water areas around your house, school and community where mosquitoes breed. Put salt or abate in containers with standing water in the house, such as a vase and saucers in the pantry, to prevent mosquitoes from breeding. Okay? Next page, page 118. Number 3, 5 things to do. Number 3, listen please. Number 3, 5 things to do. Number 1, close. Close and containers. Close any containers with standing water, such as jars and concrete water stamps in the bathroom. Close any containers with standing water, such as jars and concrete water stamps in the bathroom. Number 2, change the water in containers with standing water to prevent mosquitoes from breeding, such as a vase or flower pot saucer. Change the water in containers with standing water to prevent mosquitoes from breeding, such as vase or flower pot saucer. Number 3, add. So 5 things to do: close, change, add, adjust, and perform. So number 3, add. Add fish, such as swordtail with fish or guppies, into water containers what cannot be closed, like lotus flower tanks and fish tanks. Add fish such as swordtail fish and guppies into water containers that cannot be closed. Put the fish there, like lotus flower tanks and fish tanks. Yes, lotus flower tanks or fish tanks. Yes, with water. Okay. Adjust the environment in the house area to be airy, light, and open. Mow the grass and cut the branches of trees. Everybody listen please. Yeah, not right. Just listen. Just listen. You need to write. Okay. Okay, adjust the environment to the house area. Be airy, light, and open. Move the grass and cut the branches of trees. Yes, branches of trees. Open windows to let the light in. Open windows to let the light in. Perform the elimination of mosquitoes breeding area every 7 days. Perform the elimination of mosquitoes breeding every 7 days. Yes, okay. The next one, measles. Measles. Number 4, measles. Good. Measles. Measles is caused by a virus. Both children and adults can be infected by measles. Infected by measles in all seasons, especially during the winter season. Transmission and can be transmitted through coughing or sneezing, such as sneezing. The virus is spread by the body fluids of infected people, such as saliva and phlegm. Close contact with infected people can lead to infection. Symptoms of measles include high fever, number 1. Number 2, skin rash. Number 3, runny nose and coughing. Number 4, red eyes with a lot of mucus and light sensitivity. Number 5, sore throat. Number 6, rash and face which can spread to the body, arms, legs, and feet. Number 7, the rash turns from red to a darker color and cover the entire body with small bumps. You can take a look at this picture, yeah? Okay, this picture. Number 8, it can cause complications like pneumonia, otitis, diarrhea, encephalitis, conjunctivitis, and cough. In several cases, it may cause blindness and even death. Guidelines for people infected with measles. Okay, write down again. Guidelines for people infected with measles. Yes? Right again. Write down that you will know what did we learn, okay? Guidelines for people infected with people infected with not virus. Infected with not virus. Measles. Measles. I'm sorry, I didn't write here. With dengue fever. Okay. Guidelines for people infected with measles. Number 1. Take paracetamol and rub your body with a damp washcloth if you have high fever and prevent shock. Take paracetamol and rub your body with a damp washcloth if you have high fever for prevent shock. Number 2, rest a lot. Rest a lot. Number 3, drink a lot of water to prevent dehydration. 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 Drink a lot of water to prevent dehydration. Number 4, eat healthy and easily digestible food like rice, soup, and porridge. Eat healthy and easily digestible food like rice, soup, and porridge. Number 5, apply calamine to reduce itchiness. Apply calamine to reduce itchiness. Number 6, stay in a place with less light to reduce eye irritation. Stay in place with less light to reduce eye irritation. Number 7, take any medication according to the doctor's prescription. Take any medication only according to the doctor's prescription. Guideline for people infected with measles. Yes? Number 1, separate infected people and keep belongings away from them. Number 2, avoid close contact with people who have measles until it is certain that they are cured. Avoid close contact with people who have measles until it is certain that they are cured. Number 3, always clean your clothes and bed sheets after recovery. Always clean your clothes and bed sheets after recovery. And number 4, stay healthy by eating healthy food and having enough rest. Stay healthy by eating healthy food and having enough rest. Turn to the next page. Chickenpox. Write down number 5, chickenpox. Write down chickenpox. Chickenpox. The last one for today. Yes? C. It's chickenpox. CH. Chicken. Do you know how to spell chicken? C-H-I-C-K. Chickenpox. Finish. Okay, this is good. Chickenpox. Chickenpox is caused by a virus which can affect children and adults. Girls, stop talking please. Listen to the teacher, okay? This is not for me, it's for you. Chickenpox is caused by a virus which can affect children and adults. Transmission. Chickenpox can be transmitted through coughing, sneezing, or inhaling, sharing items with or touching infected people, especially at the blisters, will make the disease spread easily. Pregnant women with chickenpox infection can transmit it to the baby in the womb. Listen. It can be a severe infection for infants. Symptoms. Number 1, fever, low fever in children and high fever in adults. Yes. Number 2, loss of appetite, fatigue, body aches. Yes. Number 3, a rash develops on the body, back and face. On the body, back and face. Legs and arms with the fever or 1 day after fever. Number 4, red bumps become blisters filled with fluid. As the blisters scab over, They are very itchy. Yes, very itchy. Chickenpox is a disease with a fever that usually lasts for a few days. The blisters are more severe in adolescents and adults than children, and they will gradually escape over within 1-3 weeks. Guidelines for people infected with chickenpox. These are guidelines for people infected with chickenpox. They say you can write these guidelines for people infected with chickenpox. You can write down. Number 1, take paracetamol to reduce the fever if you have a high fever. Take paracetamol to reduce the fever if you have a high fever. Number 2, take enough rest and drink a lot of water. Number 3, always take care of and clean your skin. Always take care of and clean your skin. Number 4, if you feel very itchy, use antipruritic or reduce itchiness. Number 5, do not scratch the blisters as they may get infected. Do not scratch the blisters as they may get infected. Prevention of transmission and spread of chickenpox. Prevention of transmission and spread of chickenpox. The same, prevention, you can write down if you want. Number 1, do not get close to or touch infected people as the disease is contagious. Okay? Number 2, stay healthy and have enough rest. Number 3, infected people should avoid getting close to others and cover your mouth and nose every time for sneeze or cough to prevent the spread of disease. Number 4, get a chickenpox vaccine. Get a chickenpox vaccine. 1 dose of chickenpox vaccine for children aged between 1 and 12 years old. 2 doses for children of 13 years old or more, at least 1 month apart from each dose. 1 month. According to research, immunity can last for 20 years. Okay, that's good. And for now, unfortunately, Nippon, you have a home task. You have a home task. Home task. Let me text your home task, or let me write your home task. Okay. Let me write down your home task. Home task. Only read. Wait, let me do it right first, and then, okay? Okay. We'll have final test soon. Yes, do you know that? What can I do? We have to. We have final test soon. Hey. Yes. You have to read first page 116 until 121. Then activity.
Oh my God. Oh no.
Page 122. Okay. Can you see? Home class. Home class. Read again at home. And then we will have the final test. Yeah? Do you know that? You have to do final test soon. So that's why you need to read and do these tests. Okay? Okay, could you please turn around? Could you please turn around? Why are you talking? All class. All the lesson. Look at the whiteboard. Yes. 126, 127. This is unit test. Activity 122, 125. Okay? Next time we will check. Next time we will check activity and the unit test. And you can read, and you, if you want, you cannot read, but you cannot complete activity and unit test if you don't read. Okay?
Yes, I read.
Next time I will check from the beginning of the class, activity and the unit test. Okay?
Yeah. No.
Good. That's good. Okay. So everyone,
Stand up, please.
stand up please.